Blawa women have pleaded for yet another lockdown before corona gets out of control after having seen an upsurge in coronavirus cases in Zimbabwe. These sentiments were discussed in the Amakhosikazi Chatroom dialogue meeting. Amongst other questions of discussion was, will our healthcare system cope, and is our quarantine or isolation system working?
I think i-lockdown sure civil mele ibuye eqinileyo njalo ngalesi sikhathi ngoba it's really tough out there. Local transmissions semaningi kakhulu, so I think that the government should really enforce this thing, and we put aside ezinye izinto ezi-political, economical, because we cannot do all of those things xa abantu abaningi sebesifa. So let's just focus on curbing the spread of corona kathesi, and then we deal with other things later. So I also think that the government and other structures responsible for quarantine centers should really make sure that they up their game. Ukwenzela ukuthi sibone ukuthi i-corona is well monitored. Ngoba abantu labana, they complain about treatment and stuff, and some of them end up running away from the quarantine centers. It's simply because the government is not taking care of them in a way they should be taken care of. So I think lockdown regulations should really be enforced hard.
A Blawa woman said, yes, another lockdown is needed in Zimbabwe. A tighter lockdown is indeed needed because cases are uncontrollably rising every day. The reason for the rise in cases is that people are border jumping from South Africa and Botswana without going through quarantine centers. When they get this side, no one calls the toll-free line for their friends and relatives to get tested because we tell them that there is no food in those quarantine centers.
I think another lockdown is needed in Zimbabwe because recently, like a while ago, I was watching ZBC News, and it was noted that 20 cases of people who died because of coronavirus. This is not a good number for Zimbabwe. Zimbabwe itself, we are not a stable country. We cannot, in Bulawayo specifically, we cannot balance between water crisis and COVID-19 virus, because already we are suffering. Already in Zimbabwe, we are not fully equipped. Our healthcare services are quite poor. It cannot accommodate everyone. So I think another lockdown is really needed.
Another Blawa resident said, it is a sad state of affairs to note that whilst we are facing a deadly health pandemic, we don't have a health minister. Whilst people are dying, some are taking advantage of the situation and benefiting from the process. I hate corruption in Zimbabwe. Current developments have concluded to say the virus is airborne. This makes it more infectious, especially if the general populace continues with moving from one point to another. Therefore, I personally feel like we need a lockdown more than we need food, and this is how desperate we are. We can't afford further infections as a nation.
I think having another third-tier lockdown will be a wise decision, since the numbers are increasing day by day. Because if you look at it in town, it's always fully packed with people. Some will be just roaming around, doing nothing specific. And they are not even following the regulations which are supposed to be followed. No social distancing, no wearing of masks. So I think if they put tight-tier lockdown, it will be easy to monitor the people, and it will lessen the people who will be going to town just for this specific business.
Dr. Solwa Ngwenya, the Mpilo Hospital Clinical Director, said, it is good that you are asking for the lockdown now, before it's too late and Zimbabwe will not be able to survive COVID-19, a terrible global pandemic, because we have limited resources. Without a strict lockdown, only one way to the graveyard for most of us. Lockdown is no longer a debate but a necessity. It's a matter of preservation of life. If one looks at what's happening in Gauteng province, South Africa, then we realize that we are not an exemption, said Mr. Nkosana Mazwisa, a representative from #I am for Blawa fighting COVID. Final warning to Zimbabweans. Kindly take your own health and safety as your #1 priority. Follow all regulations. Get some food, and if you are not an essential worker, just hide. until we say that it's safe to come out. Lock down yourself. What you eat decide, but you'll be alive, said Dr. Solaya Ngwenya, Clinical Director. This is Jolene Mara reporting for Amakhosikazi Media in Bulawayo.